At your pleasure, Assemblymember Santiago.
Thank you, Mr. Banta and members of the committee. First, after many discussions with the chair and staff, in recognition of the issue raised by the analysis, I'm happy to accept a sunset amendment of October 2021 so that in a few years, when we have more data, we can assess and evaluate the actual market and health impacts of this bill. So I thank you very much and appreciate it, Mr. Chair, for working with us on that. AB 1102 would allow an individual to enroll in a health insurance outside the open enrollment period, making pregnancy a triggering event for special enrollment in the ACA. Currently, the law allows an individual to enroll in a health plan as a result of a specified triggering life event. Such events include getting married, having a baby, leaving incarceration, and other events. Approximately half of the pregnancies are unplanned, which means that a pregnant individual is uninsured at the time of the pregnancy and may not have an employer-based insurance, Medi-Cal, or Medi-Cal access plan. And so this bill would allow a triggering event so that an individual who is pregnant would be able to enroll into the ACA. At this point, I'd like to introduce our witnesses who will be brief, and I respectfully ask for an aye vote.
Christina Romero, Planned Parenthood Affiliates of California. Planned Parenthood believes that if a woman becomes pregnant while uninsured or underinsured, she should be able to enroll under the triggering life event clause to increase access to prenatal care and ensure better maternal child outcomes. To us, this access is fundamental to women's health, and it is necessary. We ask for your aye vote.
Michelle Cabrera with SEIU California. We're pleased to support AB 1102 as it would expand access to prenatal care and improve maternal and infant outcomes. A reasonable person does not have the health literacy or health insurance literacy to know that if getting married is covered and having a child is covered as a triggering event, that getting pregnant is not. And pre-existing conditions are no longer a factor when signing up for health insurance. We have an individual mandate. We think that the post-ACA world is different, and this provides us with an opportunity to review whether there's actually a cost benefit in terms of covering pregnant women and then avoiding potentially much worse consequences down the line, and for these reasons, we're proud to support this.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty. Just we're here in support. Very briefly, Chaburb did make an error. Women are only eligible for the access program. The Medi-Cal access program previously aimed to 322% of the federal poverty level. So most women are eligible for some kind of Medi-Cal. We want to make sure there's a welcome mat to all women. Most of them don't need an open enrollment period, but they don't necessarily know that. They think they need to wait for the open enrollment period. Most of women will be eligible for one of the Medi-Cal programs. We want to make sure they get in, and we urge your support. Thank you.
Additional witnesses in support?
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Thank you. Seeing no additional witnesses in support, witnesses in opposition? Sure.
Good evening. I'm Jennifer Caballos on behalf of the California Association of Health Plans. CAP members feel strongly about the importance of prenatal care, and the ACA makes it possible for all women to have access to care regardless of their health status. Currently, there is a mandate for individuals to obtain coverage, and there have been 2 open enrollment periods in order to do so. During the open enrollment, health plans do not screen new enrollees for any pre-existing health condition. CAP is opposed to this bill because it does not create a policy that sends a message encouraging Californians to obtain health care coverage. We think that state policy should support the hard work done by the exchange, encouraging Californians to enroll in coverage before they need it. Maternity care is included as an essential health benefit and includes vitamin supplements, screenings for RHI incompatibility, and other conditions, plus ongoing screenings such as anemia and gestational diabetes. These are free screenings because they are preventative. In the independent analysis of this bill conducted by the California Health Benefits Review Board, they stated that permitting people to enroll just when a health condition arises could disrupt the basic tenet of health insurance, which is to spread risk among policyholders to improve affordability. The Chburp analysis also indicated that the impact on covered California plans will be as low as $22.8 million and as high as $75.8 million. Medi-Cal continues to offer free coverage, and sizable subsidies are available to women with moderate incomes as they were prior to implementation of the Affordable Care Act. This bill will result in a premium increase for the existing enrollees that have obtained insurance in the individual market that have already they will see an increase in their premiums based on the increased cost for allowing this type of enrollment into a plan. For these reasons, we respectfully ask for a no vote on this measure. Thank you.
Stephanie Watkins with the Association of California Life and Health Insurance Companies. While we appreciate the intent of the bill, we fundamentally feel that this starts down a very dangerous path. This, for the first time, ties open access to a medical condition versus a life event. So the question for us really is, where does it begin and end? While we have compassion for women who find themselves pregnant, we also want to encourage all Californians to opt to purchase health care coverage. This creates a system where you potentially start to undermine reasons for which this demographic may choose not to opt for coverage, which is certainly a concern for us. It also opens up a pathway for which pregnancy is the first medical condition, but there are also others. There are chronic conditions, cancer, other things that people presumably did not expect and then find themselves ill. Once we go down this path, we certainly have great concerns that this opens up additional pathways. We also believe, and I'd like to quote Chburp because I think there's really some key findings that were somewhat startling for us. Chburp estimated that 25% of women would be expected to temporarily add coverage for maternity and childbirth. In real terms, while these new enrollees would pay a total of $940,000 in premiums, they would utilize almost $6.8 million in services. This would be equal to a net impact to covered California of $5.8 million. Additionally, Chburp estimates that up to 33 covered California individual enrollees may become uninsured if the 25% of enrollees drop existing coverage due to increased cost and premiums. We think that there's a real unintentional consequence to this. While we empathize with the situation, we really want to highlight the importance of people enrolling in coverage early. There are open enrollments, there's no pre-existing condition, there's no exclusions. So to really target this audience, it's important to give them incentives to get them into coverage. People are better off with health care coverage, they're better off with preventative coverage. Once you start down this road, to give people options for which, once they find themselves in a certain situation or medical condition, they can opt in, it incentivizes them not to get coverage early. So for those reasons, we remain opposed to the bill.
Additional witnesses in opposition? Seeing none. Questions from committee members? Assemblymember Waldron.
Thank you, Mr. Chair. For the author and the witnesses, generally we're talking about young women, who would find themselves obviously in this predicament, and they're sometimes the part of the invincible. They're not used to getting health care. They haven't done that. So when this happens, might be the first time when they realize, oh gosh, now, I have to take it a little more seriously, and, they want the best start for their child. And, when I heard this, when I was reading about this bill, it brought me back to when I was literally 10 days before my due date when I was pregnant, and my insurance company changed my doctor. I got a thing in the mail that I had a new doctor that was, 30 miles away, and I panicked. So I can understand, the situation a little bit, even though it's a little unrelated. But, generally, that's what we're talking about. People who normally wouldn't until this case. And then, because they would have the baby, then they would need to have, the service, the health plan continue for them. So, that's sort of what I see as a benefit of this.
Thank you.
Additional questions from members? So Member Padilla does not have any questions. I believe the goal of your bill is well intended, Assembly Member Santiago, and by increasing access to coverage, the bill could very well have a positive public health impact. I think it's important to remain clear that this bill would have a relatively narrow application. The bill applies to women with incomes over a certain percentage of the federal poverty level only. These are women who would otherwise be eligible to enroll in coverage after giving birth. This bill essentially allows these pregnant women a chance to obtain coverage earlier, and in doing so, they will be able to obtain prenatal care and other health care services that will hopefully produce better birth and health outcomes and reduce costs down the road. On balance, I recognize that there are challenging questions and concerns with the potential market impact of this bill. For this reason, I asked you to consider a sunset on the bill so that in approximately 4 years we can assess and evaluate the actual market and health impacts of the bill. Thank you for accepting that amendment.
Absolutely.
With your acceptance of that amendment, I am supporting this bill today and recommending aye.
Thank you.
We have a motion. Yes. The committee can entertain a motion. We have a motion and we have a second. The motion is due pass as amended to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Bonilla? Bonilla, aye. Burke? Burke, aye. Chavez? Chavez, aye. Chu? Gomez? Gonzalez? Gonzalez, aye. Hernandez? Lackey? No. Lackey, no. Nazarian? Patterson? Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago?
Aye.
Santiago, aye. Steinnorth? Steinnorth, aye. Thurmond? Thurmond, aye. Waldron? Waldron, aye. Wood? Wood, aye. 11.
The bill is out. Count is 11-1. Congratulations, Assembly Member Santiago. Next, we have item number 30, AB 1485, Assembly Member Patterson.
Thank you, Mr. Chairman and members. Pleased to present AB 1485. I am accepting the technical amendments suggested in the committee analysis, and thank you for that. Thank you.
We have a motion and a second.
AB 1485 will update California's Medi-Cal law to be consistent with federal Medicare and Medicaid fee-for-service policies for the reimbursement of radiology services. Medicare and Medicaid allow for the enrollment and reimbursement of radiologists regardless of their location in the United States, as long as they are licensed in the state where the beneficiary resides. State regulations governing provider enrollment and reimbursement in the Medi-Cal program have not kept pace with technological developments in the practice of radiology. Today, high-speed broadband and the Internet are providing patients unparalleled access to radiology subspecialists, which can, within minutes, provide expert analysis to attending physicians, regardless of location of the patient or radiologist. Privately insured and Medi-Cal managed care patients already benefit from this access to subspecialists and the timely and accurate diagnosis they can provide. Medi-Cal fee-for-service patients should be able to have this benefit as well. This improved access to care is particularly critical in rural, underserved, and overnight settings. AB 1485 will allow for this equal access to care by modernizing existing law so the Department of Health Care Services may enroll California licensed radiologists as Medi-Cal fee-for-service providers regardless of their location. I have with me Jennifer Capitolo to testify on behalf of the bill.
Good afternoon, Chairman and members. My name is Jennifer Capitolo on behalf of VRAD, Virtual Radiologic, which is a teleradiology company that employs California licensed radiologists to provide supplemental specialty services to California hospitals and radiology groups. These hospitals and radiology groups contract with teleradiology companies to cover the night shift or work overflow or to have subspecialty providers in rural areas. As Assemblyman Patterson said, this bill simply brings Medi-Cal fee-for-service reimbursement policy in line with Medicare, Medicaid, and the rest of California's insurers. For those of you that were on this committee last year, Chairman Bonta carried AB 1310, which was a significantly broader version of AB 1485. It applied to all healthcare providers. When we had labor opposition to the bill last year, we did say that we would narrow the bill and we would make sure that this was supplementing services, not supplanting. We kept that promise, and AB 1485 only applies to California licensed radiologists, again, consistent with Medicare and Medicaid policy. And this brings California in line with the other 41 states who do have this practice. No California healthcare jobs will be supplanted. A California patient under the supervision of a California physician has to go to a California facility, be scanned by a radiology tech. And since radiology is a contracted service, these California radiologists, their jobs will not be supplanted. We are meeting and communicating with labor in good faith effort to work with them on their concerns. We have taken some amendments that say that this should not be considered a precedent for any other healthcare professions. We were surprised by labor's late opposition because we thought we were working with them. We are continuing our conversations with them. We are committed to working with them. This bill is not charting new territory. It simply recognizes that teleradiology is the reality of practicing radiology in the United States, and we ask for your support for this bill.
Thank you. Next.
Amber King with the Association of California Healthcare Districts. We represent 28 of the state's rural hospitals and 20 of the state's critical access hospitals. Our districts are increasingly using telehealth to provide services in the most remote areas of the state, including teleradiology, but also a lot of specialty services. We believe this bill is a good step towards alleviating a lot of the challenges surrounding telehealth and increasing access to care in rural areas. Thank you.
Mr. Chair and members, Bob Ackerman on behalf of the California Radiological Society. We appreciate the amendments to the bill in terms of the intent language. We are neutral on the bill. This is a modern technology that's being employed throughout California, transmitting images, and radiology is a part of that, and we're fine with the language. Thanks.
Thank you very much. Thank you. With that, we have others in support or opposition, but I do appreciate the opportunity to present.
Thank you, Assemblymember Patterson. Additional witnesses in support? Seeing none, witnesses in opposition.
Good afternoon, Mr. Chair, committee members. Mr. Chair, as you know very strongly, you introduced and supported AB 1310 last year, which is a much broader piece of legislation, as was discussed earlier in the supporting testimony. I'm Doug Chiappetta. I am the advocate for the Union of American Physicians and Dentists with the American Federation of State, County, Municipal Employees. Several of my colleagues could not be here today, but they echo our opposition to this legislation. Let me just cut to the chase. Last year, this was a broader bill for telehealth services trying to get out utilizing Medi-Cal dollars for underserved and rural areas, and we commend your effort, Mr. Chair. Unfortunately, we were unable to resolve our concerns at the 11th hour, but we thought it was a noble piece of legislation and would again work with you in that regard as we put forward. With respect to this bill, teleradiology, the same concerns are brought forth by labor. We're still utilizing Medi-Cal dollars, which in fact are used by my members who have clinical practices in the state of California and use them as a secondary practice. We do use Medi-Cal dollars to serve the underserved and rural and indigent throughout California, so that is a misrepresentation. With respect to the economy, we believe putting dollars outside the state of California is not the way to go. It's hurtful to our economy, and ultimately there are jobs that are going to be lost in the process. We respect the author's intention and what he's trying to accomplish. We think it's a noble effort. At this juncture, we remain opposed. Thank you.
Mr. Chair, members, Sarah Flox, the California Labor Federation, and we do apologize for our late opposition. We were not listed in the analysis, and we appreciate the work of the author and the sponsors to narrow the scope of this bill and the intent that is not meant to be a precedent. However, we do echo the concerns of our affiliates that this is a bill allowing work that could be done by in-state physicians and radiologists to go out of state with Medi-Cal dollars. We should be investing in our health infrastructure and our health access needs here by investing in our healthcare workforce. And for those reasons, we oppose the bill.
Mr. Chair, member Stephanie Roberson on behalf of the California Nurses Association. We too in the late opposition apologize our letter didn't get to the committee in time. We're working very short staff, so I apologize to the chair and to the consultant. However, I echo the comments of my colleagues. For us, the opposition is more of a fundamental one in that we understand that they've narrowed the bill in scope, that they require the practitioner to be licensed in the state of California, but unfortunately, that provider doesn't have to reside in the state. Those Medi-Cal dollars, as said previously, still could flood from out of the state to other areas of the country, and with that, we still oppose. Thank you.
Additional witnesses in opposition.
Eric Robles with United Nurses Associations of California. ASME in opposition.
See no other additional witnesses in opposition. Any questions from committee members? Yeah. Dr. Wood.
Just a comment. First of all, I represent a very rural district, and the whole concept of telemedicine is a big deal. Is a big deal for us. I want to support the bill, but I also understand the concerns on the other side as well. I mean, we don't want to lose jobs in California. We don't, and I appreciate not wanting to have the money going out of California. So I'm going to support the bill today in the hope that we can continue to work with labor to try to work through this, because fundamentally in my rural district, the use of telemedicine is a really big deal. And I'm talking about, there's lots of different ways of telemedicine, but teleradiology, to be able to transmit x-rays and get results on a really short turnaround could be really, really valuable to patients. And ultimately, that's my biggest concern, is how do we get the best quality care for patients in the shortest amount of time? And if that means a little bit of flexibility somewhere, I'd like to be able to continue to explore that. So I know just in general, in Humboldt County, for example, and this kind of illustrates the challenge. One of the hospitals actually hired a radiologist to come to Humboldt County, and they hired him, but they ultimately didn't have enough work for him. And but in order to retain him, he was allowed to take work from other states. In other words, he could read x-rays from another state and have that come in. Now, that was money coming into California, essentially, and allowing a radiologist to be in a remote rural county. And so there is a little bit of a two-way street on this. So the value for Humboldt County was having the radiologist there. Without that flexibility for him, there probably wouldn't be that radiologist in Humboldt County, and once again, my rural county would be underserved. So I appreciate where you're going. We're obviously at a bit of an impasse, and I really want to figure out a way for us to be able to make everybody happy, and in the end, that our providers, that our patients, and everybody is well served throughout this. So anyway, thank you.
Additional questions from committee members? Seeing none, thank you, Senator Patterson, for bringing this bill. This bill aims to clarify existing law for a small portion of patients only, Medi-Cal fee-for-service patients, and a small subset of providers in the field of radiology. This is really a clarification bill, as I talked about last year for AB 1310, to provide clarification for DHCS. I think that the conversation should continue so that we can ensure that Medi-Cal fee-for-service patients get access to the same services that patients under Medicare, private insurance, and Medi-Cal managed care currently receive. And I know from firsthand experience that important issues from labor have been raised since late last year in September, and that there have been discussions. And the bill reflects some of those discussions with the narrowing of the bill just to the field of radiology, and also with the no supplanting language. So I appreciate the progress that's been made on the bill. It sounds like there are ongoing concerns, and because of the late notice of the opposition, it appears that additional conversations are probably in order. So I highly recommend that you have those conversations and see how you can strengthen the bill, and as Dr. Wood said, try to accommodate all the critical stakeholders here. So I encourage you to keep talking, and appreciate the progress that you've made so far, and hope that more will be made in the future. I'm going to support the bill today, and I recommend an aye on the bill for the committee.
Thank you.
So thank you, Assemblymember Patterson. Would you like to close?
I would like to close very, very, very briefly just to say I really want the committee and the members of Labor to know I fully understand and appreciate their concerns. And as others have said in support of this, we will do everything we know how in order to, as was mentioned, narrow and to deal with those fundamental concerns. We're going to keep that going. And at the same time, we recognize that we are, as Mr. Wood has suggested, in sort of this two-edged sword kind of thing. So with it moving forward, you do have my commitment to continue to do what we've done from the beginning in creating the bill and moving it ahead. With that, I ask for your support.
Thank you, Assemblymember Patterson. We have a motion and a second of due pass as amended to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine?
Aye.
Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez? Aye. Chavez, aye. Chu?
Aye.
Chu, aye. Gomez? Gonzalez? Gonzalez, no. Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Patterson? Aye. Patterson, aye. Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez? Santiago? Steinnorth? Aye. Steinnorth, aye. Thurmond? Waldron? Aye. Waldron, aye. Wood? Wood, aye. 11-1.
The count is 11-1. The bill is out. Congratulations to Assemblymember Patterson. So a quick announcement. Item number 9, AB 463. Item number 9, AB 463. The author is holding the bill, and it will become a 2-year bill. Next, we have AB 20. Item number 26. AB 1305. Bonta.
Mr. Chairman, you may proceed.
Thank you, Mr. Chair. I want to begin by accepting the amendments proposed in the committee analysis to clarify that high deductible health plans will be required to include a per individual deductible that conforms to minimum deductibles required by federal law. AB 1305 prohibits health plans and insurers from giving a person a higher deductible and out-of-pocket limit simply because the person is a member of a family. This bill would require a plan or insurer to include per individual deductibles and out-of-pocket limits for each individual in a family plan. The bill creates parity between what consumers pay in individual and family plans and protects consumers from having to pay more toward their care simply because they are a member of a family covered under a family plan. AB 1305 aligns with Covered California for family plans sold through the exchange. It also aligns with federal laws, federal law requiring individual out-of-pocket limits in family plans. And just a quick note on the impact of this bill. Almost 98% of enrollees are already in plans or policies that comply with this bill. The remaining 2% are in high deductible health plans, which according to CHBRP would be the only type of plans affected by this bill. As such, the bill will provide for important protections for consumers and in doing so have only a modest impact on the market. With me today is Beth Capel, representing Health Access, the sponsor of this bill, as well as Betsy Imholtz of Consumers Union to testify in support.
Beth Capel on behalf of Health Access California, pleased to be here in support of this bill, which implements and improves on the Affordable Care Act. I ask the members of this committee to remember that the maximum out-of-pocket is $13,200 for a family, $6,600 for an individual. What this bill says is if you have a family where mom has cancer or MS and dad and the kids are pretty healthy, the family spends $6,600 on mom at the maximum, and then whatever little bit of care dad and the rest of the family need. This is an important consumer protection to make real the promise of the Affordable Care Act that people should not go bankrupt as a result of medical costs. We ask for your support. Thank you.
Good evening, members of the committee. Betsy Imholtz, the Policy and Advocacy Division of Consumer Reports, here in support of the bill. Health insurance is one of the most complex products consumers buy. Did you move it? Yeah. And this bill will provide a benefit to the 2% of people who don't already have it by giving them embedded individual coverage, and we support the bill and urge you to vote aye.
Further witnesses in support, name and organization and position only, please.
Absolutely. Elizabeth Landsberg with the Western Center on Law and Poverty, in strong support. Thank you.
Kimberly Chen with the California Pan-Ethnic Health Network, CPAN, in support.
Greg Herner on behalf of Leukemia and Lymphoma Society, in support.
Sarah Flox, California Labor Federation, in strong support.
Autumn Ogden with American Cancer Society Cancer Action Network, in support.
Any further witnesses in support? Seeing none. Witnesses in opposition?
Thank you, Mr. Chair and members. Mira Morton here on behalf of the California Chamber of Commerce. We are officially opposed to the measure. However, we are reevaluating it in light of the CHBRP analysis, which asserts it only applies to high deductible plans. And the way that it would play out in that scenario, I think, is very different than we had anticipated. So we're going to be verifying that that's true. Also, we will be working with the author to see if we can resolve the issues where it might discourage or prevent individuals from being able to access high deductible plans with a health savings account. So at this time, we're not urging your no vote. We're just continuing to take a look at it, and then we'll follow up with committee members afterwards. Thank you.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. We're kind of in a tweener. We have concerns. We appreciate the most recent amendments. We're still trying to confirm what's required on the federal level versus covered California. We think it's important to conform to the federal requirements and not exceed those. So that's something that we'd like to continue to work with the author and the sponsor as the bill moves forward.
Thank you, Mr. Chairman. Members, Julianne Broyles here on behalf of the California Association of Health Underwriters. Also appreciate the amendments, are going to go back and evaluate it. We've spoken with your staff at length, trying to make sure that tools that are available at the federal level remain available to the business community and to the agents here in California. Look forward to continuing that discussion.
Thank you. Any other witnesses in opposition? Seeing none. Questions or comments from the committee? Seeing none, Mr. Bonta, appreciate all your efforts to work through the issues with the opposition. I know you've worked hard on that and will continue to do so, so appreciate that. Mr. Bonta, you may close. Do we have a motion?
Yes.
We do. We have a motion, a second. You may close.
Thank you, Mr. Chair and members. I respectfully ask for your aye vote.
Thank you. We have a motion and a second. Do pass as amended to approps. Ask the clerk to please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine?
Aye.
Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke, aye. Chavez? Aye. Chavez, aye. Chu? Chu, aye. Gomez? Gonzalez? Aye. Gonzalez, aye. Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Ridley Thomas, aye. Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Steinnorth? Steinnorth, aye. Thurman? Thurman, aye. Waldron? Waldron, aye. Wood? Wood, aye. That's 16.
Your motion is out, 16-0.